Welcome and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. Are you one of them women who are in their ages of 40 to 60 who are suffering from hot flashes, night sweats, tiredness, mood swings, uneasiness, and irritability? We're going to learn about something today that might help you help millions of women over 15 years in Europe, and that is a treatment that is known as a natural treatment for menopausal symptoms. Our guest joining us here on the program today has been practicing obstetrics and gynecology in the Upper East Side of Manhattan for more than 3 decades. She is also attending physician at Lenox Hill Hospital, where her interests include laparoscopic surgery, adolescent medicine, bioidentical hormone replacement therapy, and, of course, the everlasting joys of obstetrics, both low and high risk in concierge settings. She joins us here on the program today to talk about Relizen, which is a natural way that we might be able to overcome the symptoms of menopause. I'd like to welcome to the Beyond 50 radio program today our guest, Dr. Ellen Manos. Dr. Manos,
hello.
Thank you for being on the program.
Hi.
Now, let's talk about what this is, this menopause. Is this something that's natural, and is there a natural way to actually help this? What is menopause?
Well, menopause itself is a natural event. It's absolutely normal in women. It is really the end of a woman's reproductive life. It's now that women are living probably longer than ever, it's almost half of our life that is being, lived during menopause. And it really is defined as a year, 1 full year without having a period. That's the way we define menopause. So, of course, there's a lot of varying situations where this can happen. It can happen after a surgery, which, of course, is not a natural event. But if your ovaries are taken out for any reason, of course, you're going to go through a sudden menopause. But for most of us, it's kind of a transition for 2, 3, even 4 to 5 years where our periods get haywire, spread out, our symptoms start getting worse, and eventually, after a full year of not having a period, we're called postmenopausal. So that's really what menopause is defined as. Of course, every woman goes through it differently, and every woman can suffer differently, or some of the lucky women don't suffer at all. But the bottom line is the majority of women go through some annoying and some really, heart-wrenching symptoms that can affect their lifestyle. So this is why we're really paying attention to treatment of these kind of symptoms.
Now, it sounds to me then, and I guess a very direct question is, does menopause happen overnight? What's the process?
Yeah, it can happen overnight, as I said, in rare situations where you're having a surgical menopause, which I suppose aren't so rare anymore. I mean, if your ovaries are removed, you're not going to have any more estrogen, because when you hit menopause, the highlight is that all your hormones go down to practically zero, and if your ovaries are removed, and that's usually surgically, for an ovarian cancer, for some sort of reason that is a good reason, you're going to go through menopause within the next 48 to 72 hours. It's going to be acute. It's going to be miserable. On the other hand, the majority of women don't have this overnight situation. As I said a little while ago, it usually takes years, perimenopause, which is another crazy kind of word. It's always thrown around as, I'm perimenopausal. What does that mean? It means that you're going through a transition. It's the 1, maybe 2, up to 7 years of transition where the ovaries start functioning less and less. So classically, women do this over a period of time. And some women can adjust to it very easily, especially if their symptoms are mild. A lot of women don't. And as I said, for a variety of reasons, this was always ignored. We were told, don't worry about it, just plug through, you can get through it. And in many cases, women can do that, and in a lot of cases, they can't. So because it can be very, very limiting to your lifestyle and really annoying and sometimes unhealthy to have to put up with a lot of these symptoms, we've been waiting for a long time to find things other than hormones that may relieve these symptoms. So, in a nutshell, it can take a long time, and why should anybody suffer for months, let alone years?
Now, as I mentioned in the beginning of the program, a lot of times symptoms are irritability, fatigue, day and night sweats, and hot flashes, which, men even have those in their younger years. But, let's talk about what some of these symptoms really are and what's really causing them. Is it menopause, or could it possibly be things such as perhaps certain cancers or treatment for cancers that cause some of this here?
Yeah. Well, again, it's really important that, women who are having these kind of symptoms seek some sort of care, whether it's a GYN, a nurse practitioner, somebody who has the knowledge to analyze the situation, because hot flashes in and of itself, especially when it's mid-40s to early 50s, majority of times are coming from the change in the hormone, levels, majority of the times. But as you said, there could be a lot of other things going on. Thyroid dysfunction, vitamin deficiencies. Certain cancers themselves don't generally cause these kind of things, with the exception of like a thyroid cancer, which is not so unusual in women. It's actually one of the more common cancers in women. So it's important that other things are ruled out. Treatments for cancers, especially breast cancer. If a patient has breast cancer and has had their surgery and has been put on one of the medications that helps to prevent recurrence, things like tamoxifen or Arimidex. Your listeners may be familiar with these names because anyone who's undergone breast cancer treatment may be offered these kind of chemotherapies. They're oral therapies, but they are anti-estrogens. They're designed to prevent breast cancer recurrence. But as a result, any estrogen that may be hanging around in your body is nullified, and therefore you have symptoms like menopause. Whether you're in menopause or not, you can have symptoms like menopause when you're on these medicines. So assuming a woman comes in irregular periods, she gets her full workup, she's not, involved with any cancer or any thyroid disease, her blood work comes back normally, and the physician or whoever's taking care of her says, gee, you are really looking like you are going through perimenopause, then she's ripe and ready to think about different treatment modalities. And depending on her wishes and depending on her risk factors, she may want to do hormone replacement, or if she's not a candidate or doesn't want to do hormone replacement, now we have a fabulous alternative, which is a non-hormonal replacement for these kind of symptoms. So it's a fantastic alternative now that we have long awaited.
Now, what makes this new alternative that you're about to talk about so different from what's been out there traditionally?
The biggest and most important reason is that it's not a hormone and does not act like a hormone at all. It doesn't have any estrogenic activity. The beauty of the product, which you mentioned earlier, Relizen, is that it's all natural. Well, a lot of things can be all natural and not safe. And just as if things can be all natural and have estrogenic activity. In this case, it's an all-natural product derived from a pollen that's been purified and beautifully packaged in a capsule form, a vegetarian capsule form, which is fantastic. And it binds somehow to the mechanism in the brain. We know for a fact that it doesn't bind anywhere in other binding sites in the body. So it doesn't act like an estrogen. Natural things like genistein or soy-based natural hormone treatments or things for hot flashes definitely have estrogenic activity. Relizen does not. So I think the real catch here is that it isn't an estrogen, nor does it act like an estrogen, nor does it bind to any estrogen receptors. So we feel very comfortable in offering it to every sort of patient for symptom relief.
So how effective has Relizen been with women across the board that you've seen in your experience? I mean, how long have you been involved in perhaps using this to help treat the menopausal symptoms that women suffer from?
Yeah, well, as you mentioned earlier, I'm in practice over 30 years. And, of course, having graduated in the 80s and done my training in the 80s, we were a new wave of gynecologists, a lot of women interested in this kind of situation, perimenopause, postmenopause, which, of course, at that time was traditionally treated always with hormone replacement therapy or not much else. And as we discovered, there are 3 of us women that have remained friends since our residency training. So over 30-year friendship, we get together on a regular basis, and we discuss cases, and it's wonderful to be able to throw things back and forth regarding our patients, of course not mentioning names. And we were waiting desperately for something like this. So when we heard that there was a possible alternative, we really investigated. We did our due diligence reading the studies because it's been in Europe for a long time and over 15, almost 20 years, as I said, developed in Sweden. And it's interesting to us that it took that long for it to come to the American market. Part of it is who knows, the different regulations that we have here. Part of it is that the European women were using this for many, many years and feeling fabulous. I mean, there's over 1 million patient use profiles in Europe who have done very, very well. Now, of course, there are studies too. One of the biggest studies took over 500 women and really did a control study. They gave them Relizen, they gave them placebos, and amazingly, over 85 to 90% felt relief of their symptoms. And, of course, the symptoms being, most importantly, the hot flashes, the sleep disorder, and, of course, as a result of that, less fatigue, less irritability. I mean, you know as well as I that if you have sleep deprivation, it's a form of torture. So if you're waking up all night with hot flashes and you're not getting a good night's sleep, you're going to be miserable. So a lot of these things that improved, even the thought process, the clearness of thinking, were affected in a wonderful way, not only by getting a good night's sleep, but having this Relizen bind somehow in the central system up in the brain to stop the hot flashes. So when we heard about this, as I said, my old girls network, so to speak, we really, as I said, investigated it well, started treating our patients with it, and we're really excited and thrilled at the outcomes. It's not a panacea. It doesn't work for everyone, but it's certainly in my own practice, which, of course, 30 years later is growing in age as I am growing in age. I have a lot of 45 to 75-year-olds as a result. And those people who are suffering with the early symptoms and then go into their full menopause have this wonderful alternative. And I have to say, I see at least a 75% positive approval rating with this Relizen in my own practice. I mean, it's 75% get really good relief. The other 25% get relief. And as I said, it's not perfect for everyone, but it certainly is an excellent alternative. Works really well. So, yeah, I mean, in terms of my own numbers, as I said, I can't give you exact numbers. Is it 100? Is it 1,000? But it's certainly well over 500 women that have tried the Relizen in my practice and have all been satisfied. So.
Now, was a person decides to start using Relizen as a treatment for the menopausal symptoms, how long does it take before its effects begin to become noticeable?
That's a good question. Again, it varies, and some women sometimes can get a positive response. In other words, they're decreasing symptoms, especially with the hot flashes and sleep disorder, in as little as 2 weeks. But that's not usual. Most of the time it takes at least 4 to 6 weeks. That's why we encourage our patients to stick with it for at least 3 months, because if after 3 months they're not having any response in a good way, it really isn't going to work. So as I said, for my patients, they'll generally check back with me by phone or by email to let me know that they're feeling better or not. I tell them don't even bother checking in with me for at least 4 weeks. And if you're feeling better, great. If you're feeling a little bit better, give it another 4 to 6 weeks. So I encourage them to try to, stick with it for 3 months. And as I said, the majority, as I said, well over 70%, do feel better after about 6 to 8 weeks. And I think part of it is the way that it works. As I said, it's a purified, wonderful extract from a plant that is grown in central Sweden. It does seem to bind to the sites up in the brain that regulate temperature regulation sites, but also acts almost like a mild, what we're calling the SSRIs, the serotonin uptake. So it makes your serotonin, it seems to be that it makes your serotonin work better. And like many of the drugs that are given for this, which is why we're so thrilled that it's not a medication, it does take time to build up in the cells in the brain. So I think that goes along with the way it's working. It takes, as I said, as little as 2 weeks, but more often 6 to 8 weeks to see a really good response.
Now, my understanding, too, is that Relizen, as we've been talking about here today, certainly, as you've described, is not a phytoestrogen because it doesn't have any estrogenic effect. It doesn't act like estrogen in the body. But for more than 15 years, I understand that this has been available in Europe. And apparently close to more than 1 million women have actually been using this. So I guess the key question with those kind of numbers is how safe is Relizen?
Yeah, I mean, other than the, like you quoted, the phytoestrogens, there's all these other supplements that may act indirectly like mild estrogens. And therefore, their safety profiles have to be really well examined because you certainly don't want to give a patient, especially a patient who doesn't want to take any hormone replacement. Even if they call it, quote-unquote, natural hormone replacement or these phytoestrogens, it's still going to act like an estrogen. And if a woman doesn't want to be on any sort of estrogen or can't be on any estrogen because of an estrogen-dependent tumor or a history of blood clots where they're not supposed to take estrogen because estrogen can do that, make you more higher risk for a blood clot, then a supplement like Relizen fits the bill in more ways than one. Not only is it going to give you your symptom relief, but the safety profile is absolute aces because it is absolutely proven in multiple studies, really well done scientific biochemical studies, that it does not act like an estrogen, nor does it bind to any estrogen receptors. They've even done studies on women who have breast cancer and are on tamoxifen or other medications to help to prevent recurrence of breast cancer. And again, the Relizen has been absolutely neutral, has not affected it in any way. We have a study as recently as November of 2017, this past year, and they did yet another study to make sure that this particular supplement does not interrupt further pathways that could affect estrogen and breast cancer. So it's fantastic. Time over time, the studies are showing that it's safe and effective. And because it was developed as a medication in Switzerland, they went through rigorous studies there even before they started marketing it in Europe. And as you said, it's over 15 years. What I want to know is why those women didn't tell us. I'm going to have to go on the lecture circuit in Europe and chide them for that. They should have told us 15 years ago how great this product was. P.S. It's here now. It is available. And we have a fabulous safety profile, which we're very, very happy with.
Now, how can people find out more about this? Is there a website, things like that?
Yeah, Relizen has a quite thorough website. It's available, obviously, online. If you just go to Relizen, which is RELIZEN.com, you'll pull up the website, and there's everything I've discussed, including, the safety profiles, the other additional things that are in the Relizen ingredients, to make sure that there's nothing untoward, which there isn't. And it's fabulous there, or either a toll-free number. It's 855-RELIZEN, which comes to 855-735-4936, toll-free number where, we have operators available 9 a.m. to 6 p.m. Eastern time. Of course, that means you guys out west would have to be sure to do it, after a late lunch. But it's a very thorough website. It's excellent. And you can also type in your questions if you have them specifically. And they're really trying to make this a user-friendly product. It's a good product. It's been vetted very well through the medical community, which, of course, makes us women in the medical community and, of course, men in the medical community, all of us, really very happy that we have it as an alternative. So, I hope your listeners are having their interest piqued in this specific supplement because it really is worthwhile learning about.
Well, absolutely. Dr. Ellen Manuos, thank you for joining us here on the program today and showing that there is light at the end of a long tunnel where you don't have to use pharmaceutical that may have side effects that don't really give a nice effective change to something like this.
No, absolutely. I think, as you said, it's another alternative to get that light at the end of the tunnel.
And again, go ahead and give out that website one more time.
Absolutely. The product is Relizen. It's listen to me, It's Relizen.com. That's RELIZEN.com. Fabulous website, and it's also interactive. You can also, write in your questions, and one of the representatives will write back to you. And I urge you to learn more about it. It's a fantastic product.
Very good. Thank you for joining us here on the Beyond 50 radio program.
My pleasure, and send my best to the people in Oregon, a state that is close to my heart.
Will do. We want to thank you, the listeners out there, for joining in. You can also figure out more by visiting us at beyond50radio.com. That is the number 50. We do encourage you to sign up for our weekly e-newsletter to keep up to date with what's going on in the world of Beyond 50 as well as our upcoming shows. I'm Daniel Davis. Thank you for joining us. This is the Beyond 50 radio program. And remember, live your day past halfway.